Hi everyone, happy Tuesday and welcome to the next edition of the Regimen Pro webinar series. I am very excited today that we are here with Dr. Mamina Turegano. Hi Dr. Turegano.
Hi, thanks for having me.
Dr. Turegano has a great presentation planned for you all about dermatology and nutrition. More specifically, as you can see on the screen, the role of nutrition and nutraceuticals in the dermatology practice. So I do just want to give a disclaimer that this talk is intended for other dermatologists and healthcare professionals. So if you're not one of those people, it might be a little high level because it's definitely intended for physician to physician. So a little bit about Dr. Turegano. We're very honored to have her. You may know her from TikTok or Instagram, but she's actually a triple board certified dermatologist in dermatology, internal medicine, and dermatopathology. She practices in the New Orleans area. She attended med school at LSU School of Medicine and then completed a combined internal medicine and dermatology residency at Georgetown in Washington, D.C., where she served as chief resident. After doing some private practice in the DC area, she moved to Los Angeles to pursue a fellowship and then moved back to New Orleans to be with her family and has been in private practice in Old Metairie for the last 4 years. As I mentioned before, she's very active on social media and she has viral videos on BuzzFeed. She has almost 500,000 followers on TikTok, so if you're not following her already, you should. And she's also made lots of appearances on the media, such as local TV stations like WDSU and online appearances with CBS and the Beauty Insider. She really enjoys sharing her tips on general dermatology to her social media following and loves teaching med students and residents and her colleagues in dermatology. So she has a big presentation plan, so I want to get to it. But if anyone has any questions, we're going to try at the end to open up for some Q&A. So please use the Q&A feature in Zoom. And without further ado, Dr. Turegano, thank you so much for joining us today. The floor is yours.
Thank you so much, Risa, and thank you to everyone for joining this call today. It's a definitely a hot topic. There's a lot to cover, and I wish I could cover more, but we'll definitely cover some important highlights and things that are just kind of buzzing around in the whole nutrition and nutraceutical world. So the title of this talk is The Role of Nutrition and Nutraceuticals in Dermatology Practice. And this topic is near and dear to my heart. I'm fortunate to work closely with Dr. Patty Ferris. She's my partner. We work together in this practice here in Old Metairie, which is a New Orleans suburb. And she's also very passionate about this topic. And I want to thank her for providing pretty much all the information that's in this presentation. All right, let's get started. All right, here we go. Okay, so clearly there's a lot out there that tells you that there's good things to eat, there's bad things to eat. It can be very overwhelming to navigate. It can also be very conflicting. So hopefully some of the evidence that's presented in this PowerPoint can help clarify some of that. Okay, so this is just a reminder that good nutrition not only extends lifespan or helps you live a longer life, but it can also improve lifespan. So basically it's not really about only about quantity, it's about quality of life. Because when we get older, we want to all hang out, and I want to play with technology like they are. They look like they're having fun. So it's all, it's the quality of life is super important, and nutrition plays a really big role with that. So I'd like to start off with this map of the world. Okay, it has markers on what are called the blue zones. So these locations include Ikaria, Greece, Okinawa, Japan, Ogliastra, Sardinia, Loma Linda, California, and then there's a peninsula in Costa Rica, the Nicoya Peninsula. And I'm sure many of you may have heard or are familiar with the blue zones, but for those of you who are not familiar, these are locations in the world where the average lifespan is higher than other parts of the world. So for example, people in Okinawa, Japan, they live to be on average to be 81, while those in the US live to be about 78 with a worldwide average of 67. The Ikaria, the Greek island, is an island that has the highest percentage of 90-year-olds, like 1 in 3 people, which is kind of crazy. And there's like a lower incidence of heart disease, diabetes, cancer. You know, in that part of Greece, they have a diet full of olive oil, greens, herbal teas. And in all of these communities, we see more fiber intake and vegetable intake in their diet, as well as lower meat consumption. There's also lower work stress, as well as just a mindset that's very family and community oriented. And then there's the Western diet. So that diet can be very high in calories, which reminds me in Okinawa, Japan, or in Japan, this phrase was actually from Okinawa originally. It's hara hachi bu. And I feel like I should pronounce this correctly because I am half Japanese. But anyways, the phrase means eat until you're 80% full. And this was like the mindset, or more of a reminder, to stop eating when you're 80% full. They found multiple health benefits when you're not stuffing your face. So other aspects of the Western diet include high glycemic index, as well as heavy amounts of dairy and meats, and high amounts of saturated fats. So we're now going to get into a little bit more science information. One way to really demonstrate how foods in our diet could be affecting our health is through this concept of mtor signaling. So mtor stands for mammalian target of rapamycin. It's a nutrient-sensitive protein kinase, and based on various environmental triggers, those triggers can then the mtor sends signals to regulate things like cell metabolism, growth, proliferation, and survival. And so this is a nice diagram to show how increased mTOR activity can play a role in various diseases. So mTOR is a complex of different mTOR proteins, receptors, and signaling molecules. And so when we have various stimuli that we commonly encounter in the Western diet, such as high glycemic, low diet, increased milk, increased meat, this can increase mTOR activity and can lead to issues like obesity, mitochondrial dysfunction, insulin resistance, type 2 diabetes, increased lipid production, neurodegenerative disease, and cancer, of course. Okay, so if we want to live a long and healthy life, our goal is really to downregulate this mTOR signaling. And there have been multiple studies. There are lots of yeast, worm, mouse models that have looked at ways to inhibit mTOR. There's two medicines that, if you're a dermatologist, that you're familiar with, or a physician, rapamycin and metformin. Both of these have mTOR inhibition. Calorie restriction can also inhibit mTOR, but that's not really possible or fun. So dietary restriction is another, it's a better alternative. So reducing things like sugar, dairy, and meat, and increasing your consumption of fruits and vegetables. So what are some things that we can get in our foods that can inhibit mTOR? This is a list of some examples of polyphenols or antioxidants that have natural mTOR inhibition. So resveratrol, we see that in grapes, pomegranates, blueberries, wine. Genistein, we can see that in beans or soy. Quercetin, we see that in onions. Actually, it reminded me, I had a video that kind of went viral of my mom who would make onion skin tea. Like, she would literally boil onion skin just because of the high amounts of like nutrients in the onion skin. And when I was researching about it, there is a really high amount of quercetin in onions. So you could also find quercetin in apples, seeds, nuts. Fisetin, you can find that in strawberries, apples, persimmons. EGCG, it stands for a long word, but you can find that in green tea. There's caffeine. So interestingly, caffeine, that's a whole nother discussion. I actually do see some issues with caffeine, but we're not going to go there today. Okay, sulforaphane, this is high in cruciferous vegetables, and curcumin, which we can see in turmeric. Okay, so this is actually one of my favorite slides in the presentation, even though there's a lot on here, but it really kind of shows the basic mechanism of how increased mTOR activity can exacerbate various skin diseases. So in atopic dermatitis, mTOR is increased in the skin, and that can increase mast cell proliferation and T cell activation. And with psoriasis, there's mTOR activity in the basal layer. And so we see an increased cellular proliferation as well as dysregulated differentiation. In hidradenitis suppurativa, we have increased gene expression of mTOR that can result in insulin resistance, as well as increased Th17 lymphocytes, as well as increased macrophage cytokines. And we're not going to talk about pemphigus vulgaris just because it's not as common, but that's interesting. And then with acne, we see increased IGF-1 and androgen production. So that can turn on sebaceous activity, which of course is an important component of acne development. So what do we tell our acne patients about diet? And I love this topic because I get asked by patients all the time, like, oh, what should I eat? What should I do? It seems like people are wanting to move away from prescriptions, not really all the way, but there's been a trend of people searching for other ways that they can improve their health and their skin so that they don't have to only resort to prescriptions. So one, normalize caloric intake, lower your glycemic load. There have been plenty of studies that have shown a correlation with a high glycemic index diet and acne development. Restricting total dairy protein consumption. Once again, a lot of studies have been done in this field. There have been some conflicting evidence with this, but overall, we do see more issues with dairy and acne, and more so with the low-fat dairy like skim milk. Decreasing whey consumption, or don't going overboard with the whey protein, especially for those who like to work out a lot, and drinking their whey protein smoothies. And then of course, increasing your intake of plant-derived mTOR inhibitors. Basically eat your fruits and vegetables, which is like such a cliche saying, but I mean, this is like the science that shows why fruits and vegetables are so important. Okay, so increasing consumption of fish. This may be more getting into like optional territory, but you know, fish is high in omega-3s, and omega-3s have been found to have some mTOR inhibition. And then adequate intake of vitamin D. Now, vitamin D, I think, is also a whole nother topic. There's a lot to say about it. There's also some controversial things to say about it, but vitamin D has also been shown to have some mTOR inhibition. So does what we eat affect the way our skin ages? Answer is yes. I think we all know that. Okay. So let's just quickly talk about this concept of the exposome. The exposome just kind of defines this interplay of the human body or the skin and its environment. So it's the totality of all these exposures that an individual is exposed to from birth to death, and it includes external exposures like UV rays, external stress, pollution, and then internal exposures like changes in the body, like hormonal variations, changes from lack of sleep, and then of course, nutrition. So glycation is a concept that this plays a big role of how nutrition impacts the way our skin ages. So collagen proteins that are sitting under our skin, they're susceptible to glycation. So this is when glucose binds to collagen thanks to the Western diet, which is very high in glucose, and this can result in what are called advanced glycation end products, or AGEs. And these can bind to tissue and can result in tissue stiffening, reduced elasticity, along with collagen breakdown. And this can result in the appearance of increased skin laxity and sallowness. So what about all the studies? Have there been studies that showed that healthier eating can actually influence the way we look? And the answer is yes. This is one of the largest studies to look at this. This is the NHANES study, looked at over 4,000 women between the ages of 40 to 74. And they had to recall their diet, and they were evaluated by dermatologists who evaluated their wrinkling, dryness, and atrophy. And they saw that a high intake of vitamin C was associated with less wrinkling and less dryness. High intake of linoleic acid was associated with less dryness and atrophy. And not surprising, with the studies that we saw with mTOR, a high fat, high carb diet was associated with more wrinkling and more skin atrophy. This was another study. This is the Rotterdam study. This was published in the JAD last year. This looked at over 2,700 patients, and their diet was assessed by this food frequency questionnaire, and the wrinkles were quantified by facial photographs. And this was interesting because they only saw significant results in women. So women who had better adherence to a healthy diet, which included vegetables, fish, poultry, nuts, seeds, mineral water, and wine, that was associated with less wrinkling, but they did not see any changes in men. And then the corollary to that, with women who had an unhealthy dietary pattern, such as increased consumption of meats, grains, snacks, soft drinks, coffee, and alcoholic drinks, there were more wrinkles in those women, but they did not see any difference in men. And this is another study that looked at photoaging and diet. They looked at 3 different populations: Greeks, Australians, and Swedes, and they looked at screening wrinkling, and those were evaluated with microtopographic methods. And what they found, similar thing, higher intake of foods associated with less wrinkling included vegetables, olive oil, fish, legumes, when there was a lower intake of butter, meat, dairy, sugar, that was associated with less wrinkling. So this all makes total sense based on the data and the studies that we've looked at so far. So taking this a step further, can nutrition and nutraceuticals provide some level of photoprotection? I mean, right now, the gold standard is sunscreen and sun protective clothing, but we are seeing some promising results in the literature. So there have been some studies that looked at food and supplements and their ability to provide photoprotection systemically. So lycopene, this is something that we can find a higher amount in tomatoes that has been shown to reduce sunburn and other signs of sun damage. High flavanol cocoa versus low flavanol cocoa. So cocoa that has higher polyphenols. This showed a reduction in sunburn as well as increased skin density and hydration. And then with vitamin C and E supplements, it showed a decrease in sunburns. It also showed a reduction in thymine dimer formation, which we know is what can lead to skin cancer development. And then we know the most about systemic photoprotection from the studies done with PLE, or polypodium leucotomus extract. And every time I say this, I always feel like I'm saying a Harry Potter spell, but I've said it so many times that, yeah, it just kind of flows off my tongue now. Polypodium leucotomus. Anyways, PLE, so it contains a compound of various phenolic antioxidants, caffeic acid, ferulic acid, and these are potent inhibitors of reactive oxygen species. So they demonstrate really significant antioxidant, anti-inflammatory, and photoprotective activity with systemic absorption. And it really helps protect the skin in multiple ways. It's been shown to have photoprotective effects from UVA and UVB. It's been shown to reduce signs of UV-induced erythema and sunburn cells, proliferation of epidermal cells. It reduces the UV-induced production of matrix metalloproteinases, which are responsible for breaking down collagen. And it also has anti-inflammatory effects as well. And there have been some clinical studies that looked at PLE and other skin disorders, which I find to be super interesting because I incorporate this into my daily practice. So with PMLE, when patients were pre-treated with PLE, polypodium leucotomus, twice a day, it's shown to have reduced the severity of PMLE. With vitiligo, when used in combination with light treatment, it has been shown to improve repigmentation. So this is a nice little extra tool to have in your tool bag for vitiligo, just because that can be a super frustrating condition. And then with melasma, there have been a few studies that have shown improvement in Massey scores, both with monotherapy or in conjunction with hydroquinone. So now let's take sun protection a step further. Can we see chemo-prevention with diet? So using dietary or pharmacologic agents to prevent or delay the development of skin cancer. This is just a slide to remind, just a reminder that, and I think we all know this, non-melanoma skin cancer is the most common cancer found in Caucasians worldwide. It costs the healthcare system a lot of money. So, we think about this a lot as derms. How can we minimize or prevent skin cancer? But, we also think that this should be something that should be, in the minds of public health officials as well. And so the literature does support the notion that phytonutrients are effective agents for chemoprevention. So there's compounds listed here that have shown chemopreventative effects. And as you can see, there's a lot of overlap with that list of natural mTOR inhibitors. Most of these, though, have only been studied in vitro, like in animal studies, and we still are really lacking in human studies. Okay, so there's two ways that phytonutrients can protect skin cancer. They can act as blocking agents, where they block the initiation stage of cancer prevention, or they can act as suppressing agents, where they stop the promotion and progression of skin cancer formation. And so as blocking agents, there's three ways that they can do this. They can absorb the UV light and prevent that UV light from doing more damage. So polyphenols play a role in absorbing more of the UVB as well as UVA. And then the carotenoids, like beta carotene, they absorb only invisible light spectrum. This includes blue light, but this is how we can see more benefits for the eyes with the carotenoids. It also helps promote DNA repair, and polyphenols, of course, quench the reactive oxygen species or quench all the free radicals. Okay, but what's also kind of cool, even though there's like a lot of stuff on this slide, but this slide's basically showing that polyphenols, carotenoids can increase our own intrinsic antioxidant defense system. So polyphenols and carotenoids increase the NRF2 pathway, which is responsible for producing the enzymatic antioxidants that we need to quell free radicals. And so these polyphenols not only act as these polyphenols and carotenoids not only act as antioxidants, but they can upregulate our own intrinsic antioxidant defense. And so, gosh, this just kind of shows other ways that they can help suppress inflammation. They block and tumor progression. So they can downregulate inflammatory pathways like NF-kappa B and the downstream mediators of these pathways that really pave the way for tumor progression. Okay, so I think most dermatologists know about nicotinamide or niacinamide, but this has been like the most well-studied nutritional intervention for the prevention of non-melanoma skin cancer. And the really cool thing too is that it's affordable, it's easily accessible. I will write this as a prescription for patients too, and it can be covered. So this was the big study that was done. It was in the New England Journal of Medicine, the OnTrack study. They looked at 386 immunocompetent subjects with a history. They have had to have 2 biopsy-proven non-melanoma skin cancers in the last 5 years. And they were given either niacinamide 500 twice a day or placebo for 12 months. And they were also followed for 6 months after the trial, but they found a 23% rate reduction of new non-melanoma skin cancers compared to the placebo, 20% with BCCs and 30% with SCCs. Like, this is pretty profound and really could have public health impacts. And they saw reductions as early as 3 months. Interestingly, the benefits were quickly lost after discontinuing the niacinamide. So just something to think about. And also just as a reminder too, that so HelioCare is a brand, by the way, no conflicts of interest, but HelioCare is a brand that makes the formula of Polypodium leucotomas extract, but they also have the HelioCare Advanced, which has the PLE along with niacinamide. So that would also be a great option for your patients who like to make a lot of skin cancers. And this just basically shows how niacinamide or nicotinamide works. It helps with DNA repair. It also can help reduce the UV immune suppression. Okay, so it's interesting that, nutrition, we've seen it play a role with preventing skin cancer development, but can it also play a role in how patients can respond to treatment for skin cancer? So we're just going to talk just for a brief moment about PD-L1 and malignant melanoma. So this is interesting. Observations actually for this was first found in animals, because they saw that animals who didn't respond to checkpoint inhibitors, they did fecal transplants from the animals that did respond to checkpoint inhibitors. And then that they found that they were able to get response rates from the animals that had previously been non-responders. So then these studies were carried out in humans. This was done at MD Anderson. They analyzed fecal samples of 146 melanoma patients. They took a dietary history on 113 of them who were initiating immune therapy with checkpoint inhibitors. And what they saw was that bacterial diversity was highest in patients with complete or partial response to anti-PD-L1, which is really cool. And interestingly, they found that antibiotic and probiotic use was associated with less bacterial diversity. and that diets high in fiber were associated with a better response, which is not a surprise because, you know, with high fiber diets, you have better microflora. And then with diets high in sugar and processed meats, it was associated with less response. So we're seeing how the role of nutrition can really play out in how you could even respond to your treatment for skin cancer. And then, so that kind of segues into this kind of next topic of the microbiome and probiotics and how the microbiome can play a role in dermatology and how we can use probiotics potentially. So we all know that we need a healthy gut microbiome to be healthy. We need it to help break down food. It can also provide certain nutritional components like vitamin K and biotin. It helps regulate the immune system. I mean, you know, the bacteria in our gut are along the intestinal walls, and the intestinal walls are lined with lymph nodes and a very robust immune system. And, you know, it also can control our appetite. It stabilizes our blood sugar, regulates cholesterol. It can prevent certain cancers, particularly colorectal cancer. And of course, it can influence the microbiome of other organ systems. So we know that our gut can go into dysbiosis when we eat certain things. And, you know, this will be a recurring theme in our talk: processed foods, sugar, saturated fats. So too much processed foods, meat, sugar, low, and then having a low fiber or low whole grain diet can lead to gut dysbiosis. And then other offending agents include alcohol, stress, and antibiotics, which I feel like we see a lot of. So what happens when we have harmful bacteria that when we're like overloaded with harmful bacteria, the mucus layer that generally creates a good barrier function in the intestines, that gets lost, and those bacteria begin to go across the leaky gut. So they get picked up by macrophages through like these toll-like receptors and begin to start this inflammatory cascade of cytokines that are released by T cells as well as macrophages. And furthermore, the other thing that happens is these allergens that normally can't cross this gut membrane are now able to permeate through this leaky intestinal wall. They get picked up by dendritic cells, which then can upregulate Th2 cells, which then can secrete things like IgE and result in like mast cell degranulation. So people can develop more allergies. And so if we can add probiotics to the mix, we can help potentially restore this Th1, Th2 balance. And there's two ways that we can influence our gut microbiome. One is by taking probiotics, which contain viable microorganisms, or two, feeding our gut with prebiotics. And so these are non-digestible carbohydrates that selectively stimulate the growth of the good bacteria. And so what do we upregulate with probiotic bacteria? So a lot of good things happen. We can see more Th1 activity. We see an increase in the number of T regulatory cells. We see anti-inflammatory activity. We also see more pathogen killing, upregulation of the antimicrobial peptides, and then, you know, an improvement in the epithelial barrier. And these are important because this is what we want to see when we treat this, which is eczema or atopic dermatitis. We could also see a decrease in, you know, IgE production. So it makes sense that atopic dermatitis is one of those areas where dermatologists have been looking at the role that probiotics might play a role. And, you know, it can help restore that Th1, Th2 balance and enhance the skin barrier function. And so this was a very interesting study that actually was used to determine whether or not, if we pre-treat pregnant women with probiotics, will this prevent allergic disease? So this was a randomized, double-blinded, placebo-controlled study of over 1,200 pregnant women who were carrying babies that were thought to be high risk for allergy, just based on family history. And so the pregnant mom took an oral antibiotic with lactobacillus and bifidobacterium or a placebo 2 to 4 weeks before delivery. And upon delivery, the infants received the same probiotic as well as a prebiotic for 6 months after birth. And interestingly enough, they actually didn't reduce the incidence of allergic disease, but they did find a significant reduction in atopic dermatitis compared to the control group. So this is an interesting study that shows that we may be able to pre-treat women during pregnancy to reduce the incidence of atopic dermatitis. This was an interventional study that was done. It was published in JAMA Derm in 2018, looking at children. So looked at 50 pediatric patients. It was a randomized double-blind placebo-controlled intervention. Patients either took a probiotic that contained bifidobacterium, lactobacillus, or placebo. They were still allowed to use, medications, topical steroids, moisturizers, antihistamines, and they saw the patients monthly and calculated their SCORAD, and evaluated the days of their topical steroid use. And as you can see here in the top left corner, there was a statistically significant reduction in their SCORAD. And they also found that patients this is in the probiotic use, and those in the probiotic use also had significantly less topical steroid use than those of the placebo. So this was a nice study that showed both clinical improvement and decreased use of topical steroids, topical steroids. Okay, so probiotics have also been looked at in acne. So there's this notion of the gut-brain-skin axis, which I find very fascinating. And I think might have been one of the reasons why I went into dermatology. But this concept was actually kind of dated back early, like to the 1930s. There were two dermatologists who proposed that there was something going on in the GI tract as a result of stress, and that was triggering acne in patients. Now we know a lot more. We know that stress as well as diet can influence the microbiome, and that leaky gut caused by dysbiosis does upregulate chronic inflammation and insulin resistance, and all this can further increase acne. So surprisingly, there's only a few good studies. There's really not much with probiotics and acne treatment, but there's still, they still provide some interesting information. So this one looked at people who took probiotics, minocycline, or both. And once again, they used lactobacillus and bifidobacterium. They were allowed to use benzoyl peroxide and a cetaphil cleanser. And they did a total lesion count check at 2 weeks, 4 weeks, 8 weeks, and 12 weeks. And what they found here in the green at the end of the 12-week study, the combination group, so that's the green, did have a statistically significant lower total lesion count, both inflamed and non-inflamed lesions when compared to the monotherapy groups alone. And it's not on the slide, but another interesting finding from this study was in the minocycline only group, 13% of them had vaginal candidiasis over the course of the study, whereas 0 patients in the probiotic group or in the combination probiotic and minocycline group had any vaginal candidiasis. So this is a nice study that shows that probiotics can be used as adjunctive therapy, or it may be of value in our patients that we're putting on oral antibiotics for acne or for whatever other reason. So this was another more recent study. It's a small pilot study, still interesting. It looked at only 20 patients who took a liquid lactobacillus supplement. Half got the control. And they saw at the end of the study with monotherapy that there was a reduction in total lesion count. So that was interesting. Another interesting skin disorder, which is thought to be characterized by dysbiosis, is rosacea. And there have been large cohorts of patients that have been studied, and there's definitely an increased risk for gastrointestinal diseases. There's a variety of types seen here in our patients with rosacea. And one of these conditions is SIBO, or small intestinal bacterial overgrowth. And there hasn't really been much in the way of looking at probiotics and rosacea, but this is an interesting study that looked at the incidence of SIBO in patients with rosacea. So they took 113 rosacea patients versus 60 without rosacea, and they found that almost half of the rosacea patients had SIBO, and only 3 of the 60 had SIBO in the non-rosacea group. And then they treated the patients with SIBO that had rosacea with antibiotics or a placebo, and the patients that were treated with the antibiotics, 26 of 28 of them improved clinically, and that clinical improvement lasted up to 9 months. So one of the other things that is sort of a common thread with these 3 diseases, so with atopic dermatitis, acne, and rosacea, is that all of these conditions are associated with a skin barrier dysfunction. So this was a really cool paper. It was a randomized placebo-controlled trial in women, and they used a very specific type of lactobacillus. And they were given to the patients for 2 months. And what they found at the end of 2 months was that there was a statistically significant reduction in transepidermal water loss in the probiotic group. So there's evidence of barrier repair, but what's also really cool about the study is that they tested patients for skin sensitivity using the capsaicin test. So capsaicin is like that spice that we find in red peppers. And the patients in the oral probiotic group had a reduction in their skin sensitivity to the capsaicin test. So they were able to conclude that probiotics can also probably improve what we call reactive skin or sensitive skin, which is what we see all the time, right? People don't even have to have rosacea and acne. We see some people who just claim to have super sensitive skin. So it's interesting that decreased reactive skin and improved barrier function may be some of the conditions that we can treat with probiotics. So probiotics have also been looked at for photoaging. This is an interesting study that looked at the hairless mouse, and they were given either lactobacillus or placebo. They irradiated them 3 times a week for 3 months with UVB. And looking at the results here, so A is the control group. They received no probiotics, nor did they receive any kind of UV light. But the middle here, so this is like the wrinkly group. This is the hairless mice that were only treated with UVB. So no probiotics, they had UVB. And then this group here on the right, they were treated with lactobacillus. And there was but they also had light therapy. And there was a statistically significant reduction in the number of wrinkles. And as you can see here. The same investigators looked at lactobacillus and this time in women. This was a double-blind placebo-controlled trial, and they looked at patients who had both dry skin and crow's feet, and they evaluated those 2 parameters over the course of 12 weeks, and that they found that there was a statistically significant improvement in hydration at the end of the 12 weeks. There was also a reduction in transepidermal water loss, so similar to what we see in the probiotic study that was done previously. That looked at transepidermal water loss. And there was also improvement in skin elasticity. So definitely some promising results here. So what other nutraceutical ingredients are there for anti-aging? What else is being used besides probiotics and prebiotics? So we see a lot of vitamins, botanical antioxidants, essential fatty acids, collagen hydrolysates, various minerals, and of course, cannabidiol. We don't really have time to go over all of these, all super interesting topics, but we're going to talk a little bit more on collagen and CBD. So I think a lot of patients ask if they need to take collagen, or I feel like I see this running around social media a lot. And I still see like conflicting answers from various skinfluencers or whatever people trying to kind of give their thoughts. But we'll show you the data here. So collagen hydrolysate is different from gelatin. Gelatin's also collagen, but it's not hydrolyzed in the same way. So gelatin, you actually have to, in order for it to dissolve, you have to put it in hot water. Whereas collagen hydrolysate, you can, put it in a smoothie and be good to go. And they're sourced primarily from animals, pig, fish, cows, and they're enzymatically or chemically degraded collagen. And every time that they try to derive the collagen, it can yield a proprietary blend of dipeptides, tripeptides, and amino acids. So really, each of these collagen hydrolysates kind of have their own unique fingerprint. And let's talk about what happens when we ingest collagen hydrolysates, because I think that there are conflicting things out there on this. So if you ingest whole collagen molecule, that can't get absorbed. It's just too big. It has to be broken down in order for it to be absorbed. But we know that when we ingest collagen hydrolysate, collagen peptides appear in the blood 1 hour after ingesting them. Also, we have been able to determine that an increased number of hydroxyproline molecules found in the blood after ingesting cartilage that's hydrolyzed from a variety of sources. And lastly, we were able to see in an animal study that C14 radiolabeled proline was found after ingestion for up to 14 days in tissue, including skin. This was an animal study. How do they work? What happens when they get into your skin? They can really do multiple things. They can serve as building blocks for collagen elastin. They can turn on fibroblast activity by binding to receptors on fibroblasts, kind of like what our topical peptides in our skincare can do. These peptides are also antioxidants, and they could also chelate metals, and that can help downregulate oxidative stress and quench free radicals. So there was an interesting study again that utilized the hairless mouse model. These animals were fed collagen hydrolysate versus control, and they were radiated with 4 times the minimal erythema dose of UVA and UVB for 3 weeks. And the collagen hydrolysate prevented many of the unwanted effects that we see following UV radiation. So, this could just really be demonstrating the significant antioxidant effects of these collagen hydrolysates. This was a study that really kind of put collagen hydrolysates on the map when it came to treating skin wrinkling. So this study was a very pivotal study. It was a specific formulation of porcine bioactive collagen peptides referred to as Verisol, Verisol. And the Verisol collagen bioactive peptides contain their own unique fingerprint of dipeptides and tripeptides. But in this study, it was a double-blind placebo-controlled study that looked at 114 patients. They received 2.5 milligrams of the hydrolyzed collagen for 8 weeks. And what they found at the end of the 8 weeks was a significant reduction in eye wrinkle volume. So it was reduced at 17.7% at 8 weeks compared to the placebo, which actually had an increase of 14% at the end of the 8 weeks. They also did a suction blister analysis. And what they saw was that there was improved procollagen type 1, there was improved elastin. And so in addition to eye wrinkling, we're seeing that it's boosting the extracellular matrix. Cellulite. So this same collagen biopeptide, Verisol collagen, is tested for their possible benefits on women with cellulite. This was once again a double-blind placebo-controlled study. They took 105 women who had moderate cellulite and gave them the exact same dose that they had in that previous study. And they looked at patients for 6 months. They divided the patients into 2 groups, one with low BMI, one with higher BMI, and they did this cellulite pinch test and to evaluate the skin surface. And they also looked at ultrasound, and they definitely did see improvement. As you can see here, there was a statistically significant reduction in waviness. So the y-axis is the waviness. So an improvement in the surface contour of the legs at the end of the 6 months in the patients who used the collagen peptides compared to the placebo control. I'm just gonna just skip this for the sake of time. Okay, so collagen peptides and nail growth and health. So this study looked at collagen peptides, see if it really played a role with nail growth and health. This was a small study. It was not a double-blinded placebo-controlled study. It was just a open-label single trial of 25 patients. They took the same dose of Verisol for 24 weeks, and they looked at the nail growth rate and the frequency of cracked and chipped nails, and found out that the collagen peptides did increase nail growth by 12%, and it decreased the frequency of chipping and cracking by 42%. And patients did report global improvement at the end of the study. Are there any downsides to hydrolyzed collagen? Not really-ish. It's considered generally recognized as safe, GRAS ingredient. The biggest downside is that there's not great standardization. We talked about, the way that the peptides are extracted. It can have its own unique fingerprint. So there's so many different kinds out there. So it's hard to make kind of a standard recommendation, but it looks like, a lot of these significant studies were done with the Verisol collagen. There's also a concern about like fish products that could maybe have more heavy metal contamination. And then when it comes to side effects, most people tolerate this really well, but you can get some GI bloating, gas, and diarrhea. All right, the last topic, cannabinoids. So this is just a little overview, and also just kind of making sure that we're not referring to marijuana or THC. So there's a couple ways we can cultivate the cannabis plant. We can cultivate it into marijuana, which contains 5 to 35% THC. That's the plant that makes you high. And then there's the way to cultivate it to cultivate it into hemp. And hemp has to contain less than 0.3% THC. And because there's less THC, there is more cannabidiol or CBD. And so hemp is being used for CBD oil production. And this is just an overview pretty much showing that phytocannabinoids in CBD oil. CBD is not the only thing in there. There's like over 100 different cannabidiols. And it's thought to have what's called like this entourage effect, where it's not just the cannabidiol that's causing the beneficial effects of the CBD oils, but it's probably the sum total of all of these cannabinoids. And what have they been looked for? They've been extensively studied actually in derm. We do have some studies. We know that cannabidiol receptors are found in the skin, they're found in the epidermis as well as the dermis, and they can affect growth and cellular differentiation in the epidermis. They can affect inflammation. They can downregulate pain and itching. They've also had profound effects on lipid synthesis, hair growth, and proliferation. So it makes sense that these are being looked at in derm treatment. And these are currently claims that are being made about skin conditions. There's not a lot of amazing studies, but there's some good review papers in the cannabinoid literature. Sorry, this is a lot. I'm just going to mention a few that have been done. So these first two studies looked at cannabinoid topically for treating patients with acne. The first one was an in vitro study that showed that CBD does downregulate inflammation and sebum production in human sebacytes. Then they also, going back, they saw that also the 3% cannabis seed extract demonstrated a reduction in sebum content in patients with acne as well as erythema. There was studies that looked at the cannabidiol for its anti-proliferative benefits in melanoma and non-melanoma skin cancer. And, they've been looked at, this is psoriasis. I feel like there's more now with psoriasis, but there's definitely some promising results with psoriasis and how it can regulate keratinocyte proliferation. Definitely a few studies that have been done with eczema, just because it can help downregulate pruritus and other inflammatory markers. And it also looked at uremic pruritus, just because that's also an area that it can target. And interestingly, it's also been shown to have some anti-fibrotic effects and some potentially promising results in systemic sclerosis. But we still have more studies to do, but this is definitely an exciting area and a promising area. And I think that there's more to come. So I'm going to end that there. I hope that this talk was convincing that nutrition is important for dermatologists. It's to just be aware of the literature, how we can give recommendations to our patients. And if nothing else, really just to encourage our patients to live a healthier lifestyle, so that not only do they live longer, but have better health span or better quality of life. So thanks everyone for your attention. I also just want to thank Dr. Patty Ferris again for really providing this information. She is definitely one of my role models and mentors, and I'm very thankful to be able to work with her. And she's really definitely helped kind of expand my love for this topic. Also, by the way, I also want to thank Regimen Pro for allowing me to give this talk. I'm thankful to have this opportunity. This is a topic that I've always wanted to talk about, so I'm glad that I can have this platform. So thank you.
Thank you so much, Dr. Turegano. That was amazing. I know everyone else is clapping, even though we can't hear them. That was so much useful information. I do want to tell everyone that this was recorded, so we will be sending this out. If you want to go back and reference, I know Dr. Turegano mentioned a lot of clinical studies and data that you might want to cross match. So without further ado, we do have some time for some question and answer. So I encourage you, some of you have already started putting your questions into the Q&A feature on Zoom. And let's see, so here we go. This is, some are more specific and not. Oh, well, here's one about Regimen. Will or does Regimen Pro sell any of these nutraceuticals?
Gosh, I know they have Nutrafol, which has hydrolyzed marine collagen in it for hair health. But that may be a question for the higher ups at Regimen Pro.
So I know not everything mentioned in the talk was sold on Regimen today. We're not trying to just sell Regimen. We're trying to just educate the community and be a resource for people. So, but if that is something that some of you are interested in, it's certainly something that we can explore. Regimen is constantly adding new brands and products to best service our affiliates and their patients. So we'll definitely take that note down. All right. Do you have a favorite probiotic that you recommend for your patients?
Oh man, this is a tough question. Just because the more studies I read on probiotics, the less I know what to recommend patients, because there's so much that's been looked at. But there are a couple brands that I like. I like Garden of Life, which you can find at Whole Foods. And I also like the Mary Ruth's brand. They're like liquid probiotics. And then something, and that might, you have to get, like Whole Foods or some other more kind of reputable source. But something that's like easily accessible if patients want to get something at the drugstore, I would say Culturelle too.
Okay. So let's see, here's a good one. RBST is commonly labeled on food products as having no detrimental effects. However, I've noticed in my diet that I break out from dairy. But when I traveled to Europe and Asia, where RBST isn't a thing, my acne did not flare. What data do we know about RBST and the skin?
That's a really good question because I feel like it plays a role, but I don't know if we have any data that specifically looked at that. I think it just focused more on like overall milk and dairy and then like fat content in dairy versus like the specific versus containing that ingredient. So I don't know of any studies just top of mind that has that or talked about it.
Okay. How can a person balance their hormones? That's a big question.
That's an interesting question. Well, I mean, well, I guess, hormones definitely are affected, with an inflammatory diet, like with the Western diet. It's been shown to increase things like insulin resistance and can increase like androgen production. And so certainly, having a diet that, maybe I should make myself the person. Yeah, so certainly having a diet that can minimize those foods that we talked about that can increase mTOR activity. So high glycemic index diet, decreasing that, decreasing excessive dairy consumption, excessive meat consumption, and to me, like diet is really only one piece of the pie. There's so many other things. Like the state of our mind plays such a big role with our hormones, our immune system. And so, I mean, this could be like a whole TED talk, like how one can balance their hormones. Like you can meditate, you can pray. And yeah, so, but it also depends on like what specific issue you could be asking. I'm just kind of answering it generally.
Okay, that makes sense. I know it's a big question. So So here's another question. How do you address this and how do you speak to this with your patients? I mean, is this something that you bring up during general consultations that are covered by insurance, or how do you navigate this?
Yeah, because it can be somewhat time consuming. Actually, Patty and I recently decided to put together handouts, which we got from another dermatologist. I think her name is Dr. Rajani Kata. She has an amazing resource on her website. And I don't know her website off the top of my head, but she has awesome handouts. So we like printed all of the handouts and made multiple copies for each of the rooms so that we can, if we're running short on time, because we're trying to counsel patients on like side effects of medicines, it's really easy because it's just on one paper. It has like really nice infographics. So that's one way we talk about it. And yeah, I mean, I do like to just mention briefly, it could just be like 1 or 2 sentences like, hey, by the way, there have been studies that did show a correlation with high glycemic index foods, high glycemic or, high dairy foods with this disease. So just kind of like, at least just tacking it on to your other recommendations for treating their skin. But yeah, I mean, it would be great to be able to like sit down with the patient, get their like full, I mean, I like to ask patients too, like, what's their typical diet? Like, what do they eat for breakfast, lunch, and dinner, just in an average day? So, but yeah, sometimes we don't have enough time. So at least I try to tack on general recommendations. But certainly if I'm trying to dig in and figure out what is going on, I'll ask them those questions.
I see. All right. And I guess a last question, since this is the Regimen Pro webinar, can you connect these dots with skincare at all? Is there any, does any of this help drive what skincare you're recommending and, how you utilize regimen in your practice?
Well, I definitely think that when it comes to treating the skin, it helps to approach it from multiple angles. So yes, for sure, skincare, but also looking at what they're eating, looking at how they're eating, sleeping, all those things, and stress. So I think that they kind of go hand in hand. In terms of something that's specific, that can be tied into skincare from what I talked about today. Interestingly, a lot of these ingredients have been also looked at in skincare, peptides, antioxidants, and we have had great studies that have shown the beneficial effects of a lot of these ingredients that I talked about, whether it's certain peptides or, resveratrol, vitamin C, and CBD. CBD is being looked at both systemically and topically. So we can see a lot of overlap that if it's good for you systemically, there potentially could be some effects topically. And, Regimen definitely has a lot of amazing antioxidant products and a lot of amazing products that contain peptides as well. So that just kind of definitely helps confirm that we know these products have a lot of benefit.
Absolutely. All right. Last question for the day. So tell us your thoughts on the brand Nutrafol.
I like Nutrafol. I think that it has all the goodies that one would want for a hair loss supplement. I mean, hair loss can be very complicated, and there's like multiple factors that are usually involved with hair loss, but Nutrafol has a hydrolyzed marine collagen extract, which has been shown to help with hair health, help hair regrowth, and preventing hair loss. It also contains minerals that are found to be helpful with hair regrowth, like zinc and selenium. It has vitamins like vitamin D, biotin, vitamin A, and it has, one of my favorite things about Nutrafol is that it has ingredients that can help with stress, because stress plays a huge role with hair loss. So it contains like what are called adaptogens. It helps your body adapt to stress more readily. And the main ingredient in Nutrafol that can do that is sorry, I just saw a question about Viviscal. Sorry. The main ingredient in Nutrafol that can help is ashwagandha. Nutrafol has a bunch of other goodies like saw palmetto and like other like turmeric, like other anti-inflammatory properties. So there's like Nutrafol is like jam-packed. So I saw a question about comparing Nutrafol to Viviscal, which is a question that I also get in my practice. Nutrafol and Viviscal are very similar. They both have a hydrolyzed marine collagen. Now, I think they both contain different types of hydrolyzed marine collagen. So it's kind of up for debate which one's superior, which hydrolyzed marine collagen is superior. I really do like Viviscal's hydrolyzed marine collagen, I'll say that. But the cool thing about Nutrafol is that in addition to the hydrolyzed marine collagen, it has a bunch of these other ingredients that I just mentioned, all those vitamins, those minerals, the ashwagandha, the turmeric, saw palmetto, other anti-inflammatory factors. So Nutrafol is kind of more of a catch-all and has more ingredients. I think Viviscal has been around longer, so there's that.
Okay. All right. Well, again, this was so much really useful information. I definitely am going to take a second thought about what I'm eating all the time. But this was really useful, and everyone stayed on till the very end. So I think everyone else found it very useful too. We would love your feedback if you have any. A lot of people are saying thank you right now, Dr. Turegano. But overall, we appreciate the feedback. We hope you all found this useful as just another avenue to learn to educate your patients more and be more of an asset for skin and overall health and wellness for your patients. And if anyone has more questions about Regimen Pro or how to use it more or sell the Nutrafol products on there, and please contact Regimen anytime. We'd love to help you and help your patients start to use these products. So thank you so much, Dr. Turegano, and thank you everyone that joined.
Thank you for having me. Really enjoyed it.
Bye.
Bye.